Welcome, dear listeners, to the Therapy podcast. I'm your host, Tsetso, and I'm thrilled to have you join us today. This podcast is part of my mission to push the physiotherapy profession forward by making evidence-based information accessible to both patients and therapists alike. Whether you're a physiotherapy veteran looking to stay at the forefront of your field, or someone who's just starting to explore the incredible world of physiotherapy, you're in the right place. We're here to provide you with knowledge, insights, and inspiration you need to keep moving forward. But remember, this podcast isn't just about us talking to you. We want to hear from you too. Your questions, your stories, your experiences, they all matter. So please, don't hesitate to reach out to us. And if you find this podcast valuable, please leave us a 5-star review on Spotify or Apple Podcasts. You will help this information reach and benefit more people. Thank you. So without further ado, let's get started.
Again, thank you so much, Rob. Thank you for your time. I'm really appreciative of it. And I'm really looking forward to the discussion we're going to have today.
Yeah, thank you for having me, and I'm looking forward as well, Tetsuo.
Here for this podcast, I'm coming more from the perspective that I'm trying to understand more about the biopsychosocial model. As a newly graduate physio, there's many things I still don't know, and I'm still trying to understand more and figure out. So thank you for being here. Yeah, honestly. Before we start, Rob, do you mind giving a little bit of introduction about yourself, who you are as a person, who you are as a therapist, what you like to do in your free time? Just tell us who you are.
Of course. Well, as you have introduced me, my name is Rob Timmers. I'm from the Netherlands, and 59 years of age at the moment. And if I go back in time, I graduated in 1988. In a time where physiotherapy was still very much evolving and very much into the biomedical kind of vision. Like there would for us physios be mainly bones and joints and muscles and so forth. But then again, after graduating, I quite fastly in the field of physiotherapy discovered that my skills and my knowledge was really limited as a starting professional. So I needed to develop myself more. And the first thing, at least a lot of boys in my time did, was going into sports physiotherapy and then manual therapy. So I educated myself by doing what we call nowadays masters, but then at those days it were not yet masters. It were professional years education. So I became a physiotherapist in sports and in manual therapy, and was allowed with my own private clinic to help a lot of patients with their sports injuries and with typical at those times neck pain, neck injuries, neck complaints, low back complaints, but also the peripheral joints. But in time, when time went on, as you have a private clinic, you see a broad spectrum of patients. So more and more patients were elderly. And with the elderly, the Parkinson patients came in, the patients with stroke. And I found myself again very limited in the understanding and the insight and how to treat such kinds of patients. So what you do then as an owner of a private clinic, you look around and say, okay, who is interested? And I was always very interested. So then I found myself in a new education, which at that time was called the BOBAT education, nowadays neurodevelopmental treatment or neurorehabilitation. But in those times, the BOBAT method was very, very popular or very in, so to say. So I went to educate myself, becoming a BOBAT therapist or a neurological therapist. So to be able to also give patients with neurological diseases like stroke, like Parkinson's, like multiple sclerosis, the best optimal treatment from my perspective, at least, or from the updated profession at that time. And so my career went on, and slowly, as you get older, probably, so you start to connect a little bit more to the psychological part, the mental part, the spiritual part, and so I don't know exactly when that happened, but I started to get more and more interest in Eastern medicine in combination with osteopathy and then specifically craniosacral therapy. So yeah, I dived into it. Went to courses in craniosacral therapy. Became at that time a craniosacral therapist, and patients with complete different, more complex and very difficult issues came to my clinic to be treated with craniosacral therapy. That was their request. And at the same time, I dived into the philosophy of Eastern medicine, like traditional Chinese medicine, the philosophy of Zen Buddhism, and I became slowly an instructor for Qigong Tai Chi, um, and started to work out myself in that direction, as well as I guided small groups that were also interested in, can I improve my quality of life using different forms of movement, different form of interventions, maybe from our perspective, that might improve my quality of life. Yeah, and then having my own clinic at that time, a lot of students did their internships, and they gave me that extra sparkle, right? Like you and many of your peers, you inspired me, you motivated me in a sense of, wow, this is the new generation. These are young people that will be, yeah, and of course the future, the ones that are going to develop our profession more. But also you and your friends and your peers brought new elan, new energy, but also new way of yeah, looking at patients compared to maybe how I was at when I was your age. It inspired me so much that I thought, okay, let's dive into the education. And I applied for a job, a half-time job at Saxion University, where you have studied. And yeah, I became one of the teachers and was able to coach, guide, and support you and your friends in the 4 years that the education lasts to become a bachelor, yeah, to the starting professional. And that's where I still am. It's that so. I'm still at that point of being a full-time teacher now. So along the ride of being part-time, having part-time my own clinic and part-time the teacher, being teacher in Saxon University, I made a choice. Like clinical decision making is making choices, yeah, and then you have to choose what not to do, right? That's so. That's what we use. Maybe we can talk about that later a little bit when we use HOAC and do clinical reasoning. You don't do everything. You have to make a decision and say, okay, if I decide this, then I decide this not to do, right? And so I decided finally to not continue my own clinic and fully focused on the profession of teaching. That's where I am still in September 2023, sitting talking with you in your wonderful podcast. Um, yeah, that's my professional career. Further on, Ted, so I have a wonderful wife, married. I have three children that are more or less your age. Two are studying. One is in the profession. Uh, I would say the youngest one is close to our profession. He's doing sports science, but then on a bachelor level, the other is doing applied psychology. So also close to our profession.
Mm-hmm.
But the oldest one is maybe in another direction into fashion, completely different world, but also very interesting. And yeah, concerning my own personal life, I stand up very early in the morning, have my morning routine, doing yoga
Mm.
in the morning, and writing a bit or reading in books. Most likely books about meaning of life, philosophy, psychology. Go out for a run and have a breakfast. That's my morning routine, kind of every morning. Twice of those I work out to maintain some of my muscles, so to say, to not dive into the sarcopenia mystical kind of situation where elderly might
Yeah.
do. And then I enjoy my work days completely. Yeah, and evenings. like to read, like to play a bit music on my guitar, socialize with
Oh,
a few friends. I have a few very close friends. Um, yeah, so that's more or less my private life.
that's wonderful. Everything you're saying so far. Um, the reason I wanted to speak with you today, especially about this topic, is because um, well, I'm really appreciative of all my teachers. The teachers I had in Saxon, they really gave me a very good perspective and foundation for a physiotherapist. But especially you really taught me to see the person behind the patient. That's actually one of the things I wrote in my acknowledgement in my thesis. But it was really valuable for me to have a person like you who is, you know, how in the Western medicine everything is about facts and how science explains everything in the human body, but it's also the psychology behind it and the person really and how he reacts and he perceives the pain and his complaints. They
Yes,
really, all those things, the perceptions, they really influence his health outcomes.
absolutely.
So yeah, that's why I wanted to speak with you today.
Exactly. So I fully agree. I fully agree, and that's what I maybe said earlier. And that's good to have that path of history that we have been as our profession focusing on the movement apparatus, kind of only. Of course, knowing that
Mm-hmm.
there is a human being attached to the muscle and to the tendon and to the bone, but we did not really pay too much attention. So we treated the joints, we treated the symptoms, and at that time, I would say 30 years ago, acceptable. And indeed, like you said, nowadays we know that the context, the biopsychosocial model in this context, of course, but the context of how a person copes with his problems and how he therefore behaves depends on what he thinks and what he knows or what he thinks to know. So his beliefs, his core beliefs, do play an important role. And we did not pay attention in those times and get therefore a lot of residues also. So a lot of people coming again and again and again with the same complaints, maybe half a year later and half a year later. And we did not really too much think about, oh, could the reason be something else than only using the muscle too much or straining a tendon too much? Could there be maybe financial issues? Could there be private issues that are loading the patient that much that there is not too much less left for the physical part, right? So,
Mm-hmm.
yeah, I think, and that fits into nowadays thinking as well, right? In a time where everything is connected in a huge sense, like we can connect now in a very big different distance, like of, okay, technically, but uh, so we're connected via this, we're connected with the outside environment, right? Nature, cold nature, go out and we connect to breathing in good air or bad air, and that will kind of differ the chemicals in my body, right? And therefore, depending where I live, in the middle of an area, a rural area with a lot of forest and a lot of green, or in the middle of a city with a lot of cars, with a lot of pollution, that already makes us different. And when we do then the same kind of work or the same kind of sports, the one in the, let's say, as an example, right, the polluted area will probably be easier injured or have more troubles with his physical condition. If we zoom in a little bit into the physiotherapeutic domain, than somebody who has a nature where you can completely dive into and have the oxygen you need, right? And the other, situations. Yeah. So therefore, I think, the movement is clear, and we have to make it like that as physios.
Yeah, totally. Like seeing really the person behind it and his environment.
Yeah.
And we're already kind of explaining the first topic, but if we can put it into sentences, what is the biopsychosocial model really, and how does it differ from the traditional biomedical model?
Yeah. Okay. So it might help for our listeners and viewers if you look at a human being and kind of in a diagram of three big circles, right? And you could say one circle is about biology, one circle is about, amongst others, muscles and tendons, but also about the fibers, about the cells, about the mitochondrion, very, very popular little cells and bacteria, kind of, right nowadays. And a lot of people know what I'm talking about when I'm talking about mitochondria. But about balance and stability towards our domain. And that is what we call, okay, let's see the patient as, okay, he's part that, but we are not only that, we are more. In the sense, we are also uh, what we think, what we believe. We are, you are younger than I am. You have an age, I have an age. We both are men or males, but so all that is another part of us, which is which we say we put it in a circle, the psychological circle. So then we have already a biological circle and a psychological circle. Yeah, and now we would not be humans as being social animals, so to say. I don't know if you agree, but in a sense, we are always in a form social animals. So we need to engage. We too are now socializing in a sense. I need you to talk to, and you need me, and so forth, to have a podcast. I need my students to be a teacher, and you need your patients later today. So we are in a social environment, and that makes our life, it creates meaning to our life. And that's what we actually kind of want. We want to participate in a kind of social environment. And when this in this social environment, you could say there is our family, there are our friends, there are our colleagues in our profession. But there's also a little bit the side of how my finances are organized. If I'm if I have a good insurance as a human being for healthcare, for example, and that is the other circle, right? And if you now have these circles kind of halfly overlapping one and another, you create a kind of picture of, wait a minute. So here in the center, you see how the person in the center, the human being in the center, is all of that at the same time. And as a physio now, we start to try to figure out in our evaluation, when a patient comes to us with a request, how big actually are these circles? So is it really, is the biological circle the biggest one? Let's say you have a young guy, he has a wonderful, normal, happy, healthy life. He is well nourished with nutrition. His sleep is well. His friends are okay, and he gets a sports injury from one to because he got tackled football, or he got blocked with basketball or handball. You can name many. Well, that's a really very strong biological uh, injury or biological issue. And then we look into the context with the other, say, yeah, well, his belief on what happened to him, his coping style. He might be having a quite acceptable active coping style, meaning that he loads his injured joint or muscle just good enough to heal, right? And his social environment, his friends support him, so he has a good support system. Then you would, in the picture, make those circles a little bit smaller and see as a physio in one overview, wait a minute, he's still all of that, yet the biological part now can be emphasized, right? But if you look differently and you have maybe an elderly patient, being 85, we can all, patients are getting older, our population, Netherlands at least, I don't know if it's in your country the same, but if I go out here into the city, I see elderly, right? More and more people above 70, above 80, and having a little bit difficulty in walking, sometimes with a cane, balance issues. All our listeners, I guess, can relate to that, right? And now this patient falls. Yeah, or the person falls on the street and injures himself very badly. I think we can all relate to the person becoming a little bit anxious after that first time, for going out again onto the streets, maybe into a bit of crowdy marketplace and being bumped into a little bit. So he kind of gets a little bit fear of movement, like we talked about a lot of. Or he maybe starts even avoiding going out, avoiding walking more and more. So he gets in that vicious circle. Again, when we make that biopsychosocial model in those circles, now suddenly the circle of the psychological part, fear, so an emotional thing, and avoiding, so his behavior, that becomes bigger now, right? And as he cannot socialize, which presses him as well on his happiness, on his feeling of being able to be part of something, right? Now suddenly these two circles become bigger, but the bruise, maybe the strain on the hip or so is relatively, it's still important, said so, right? It's still important, but it is a little bit, you could make that circle a little bit smaller, and you immediately create that overview. Wait a minute, so I have my patient, it's still everything, he's still biopsychosocial, right? But with these circles, I immediately see, as a physio, have to pay maybe a bit more attention now onto the part of fear avoidance instead of working on gait only. Huh? Go back in time, 30 years ago, I would do gait training with the guy, with the person, let's say 80 years of age. I would train with him, walk, walk, walk. Would go out and walk. We would practice with the cane, maybe with two canes or a rollator and so on. And I would not maybe that time ago address that much as nowadays his emotional things, thoughts, his beliefs, his fear. So that has changed, and the biopsychosocial model helps us really to bring that a little bit more into presence.
Yeah, yeah, and that's where things like gradual exposure type of therapy comes into play
Exactly.
when we have a patient with kinesiophobia. But it's also thinking about it for myself in my practice. It's maybe I'm not competent enough to properly address the psychological issues, but I really struggle finding the time really to actually address those psychological issues or potential issues of the patient. Whereas I'm more into, like you said, in your very early career, focusing mostly on the bio aspect of the patient and not so much of the psychosocial aspect. So first of all, speaking for myself, the first problem is lack of time
Yeah.
with patients. Here in Bulgaria, I do have like 1 hour, which is well, with some patients it's really enough, but with others it's really not enough. And yeah, and especially when you have when you have a patient who has a specific complaint, like for example, right now I'm working with an old lady with osteoarthritis, and
Yes.
she's very lonely. Like her
Uh-huh.
grandchildren are away, children also are far away. So I have to, like, I'm probably the only person who she is seeing it who she sees every week. So I'm going there, I'm doing my treatment, focusing on the bio part, the osteoarthritis,
Yes.
and I just don't know how to help her out with the psychosocial part
Yeah.
of
Yeah.
finding friends, and
Yeah.
it's
I understand your struggle. Yeah. That is a struggle. Can I ask you? Is it a home visit what you're talking about?
I'm talking about home visits, yeah.
Yeah, yeah. Okay. Yes, yes. Yeah, of course, these are these situations that we as physios will encounter more and more. Loneliness, being alone, feeling alone, or are being really lonely. There are two different things, maybe. But we will see that more and more nowadays. And as physios, indeed, you might sometimes have that sense of, whoa, I'm actually the only person almost that this patient sees once a week or twice a week. And so that this person really is waiting, almost waiting for a few days, so you to come, right? Um, Yeah, and then you have, of course, that combination of kind of, I would say, a tiering kind of sense. Yeah, from one, I need to be the physio who helps her with her request, with her problem, with her physical, probably, and we cannot. I agree. We cannot deny that there is a person uh, behind it. That there's a person with thoughts and with beliefs and with the feeling of loneliness and wanting to con- to connect with you, right?
Hmm.
Yeah, and that will remain always for us with, let's say, the tendency to want to help. Yeah, we have, you remember, we have that help syndrome. A lot of us have the help syndrome. And we want to help. We think we are here in the world, or we choose this profession because we need to help. Yet,
Hmm.
uh, as you have, amongst others, I think in the education, for amongst others, learned to have a dialogue in the conversation, right? So having two people listening to one another, using shared decision making, using motivational interviewing techniques. And I think with the awareness, wonderful that you have the awareness that you are encountering a lonely patient and you're very aware of the situation, right? Again, that is so different from the time where I come from, a long time ago, where we would almost even not being aware of it, almost, okay? So not noticing, but just now you are aware, and that doesn't make it easier. But at the same time, with the ability of the awareness and being able to listen to your patient and ask questions, you can find out together what your patient in this example needs step by step to move out of her loneliness, of her being alone, right? And by using a dialogue, that's all. I think we physios, we take off that load of our shoulders a little bit, and also the disappointment if we are not able to help them. Yeah, and it might even be that strong. And maybe you agree or disagree that you can ask yourself, do I really help if I tell my patient what she should do to be less alone? Well, like you come up with many examples. You can join any kind of bridge club. You can go to, yeah, I don't know. There are all kind of communities, right? You can even go to a
Hmm.
religious community, to church. You can go to, yeah, once a week maybe a book club where you discuss a book what you have read. There is so many opportunities. Yeah. So, and then again, you find yourself as a physio explaining all that to your patient, how to get out of that isolated situation. And the patient is listening and says, yes, yes, I understand and I know. But then, depending on her abilities, cognitive
Hmm.
abilities, social abilities, um, yeah, self management, resilience, she might end up not doing anything. Yeah, so in these situations, and I have experienced the same as you, of course. I'm not better or different than you. I see these patients as well. And then it's really what we call nowadays, I'm going to sit down, put my hands under my buttocks, like I'm sitting on my hands, and I'm actually doing nothing. I'm listening and I'm asking questions. But I hope, like in motivation interviewing, right? I hope that my patient slowly starts to turn around and finds something that she thinks, oh, wait a minute, I could do this. Yeah? And comes up with an example herself. And then we could ask, remember maybe that question of how capable do you think you are doing this, right? And how motivated are you? And then you get like, okay, I'm very motivated. I really want this. And yeah, on a scale from 0 to 10, I think I will manage. I think I will manage to be able, and we could make even that goal smart. And it's all kind of goal setting, very important as well in our profession. Of well, I will go once, twice a week in from the morning 11 to 12. I will go. I will go with to a few friends, or we'll go to this community and have twice a week 1 hour of sense of community and slowly get out of that. So yeah, and still that's theory, and in reality it is maybe sometimes even harder. Yeah. So yeah,
And that's how.
again, good example, Tetsu, of the person in context.
Mhm.
We are social human beings, and your patients, yeah, sitting at home and withdrawing from society is actually, as we know, one of the things of getting certain diseases more often. Right? Yeah, heart disease, cardiovascular problems, cancer, aging faster, all kind of super interesting topics, super also up to date topics nowadays for our profession. So indeed, being aware of these emotional states of, for example, loneliness or fear is very essential for a physiotherapist. And I'm so happy that you could bring this here in your podcast and say, hey, because I think a lot of us physios are struggling with, honestly, we're struggling with
Yeah.
how to help. And is helping always an activity, or is helping sometimes sit back and listen? Don't help in the active form. I
Yeah.
give you an example, which maybe are for our listeners also interesting. If you have physiotherapy, and you have one of the goals that your patient's balance he would benefit from improving his balance in standing and walking and so on, right? So you practice with your patient in your clinic balance, okay? And now and then, of course, you challenge the patient that much that there is a tendency to fall. Okay? And every time when the tendency to fall is there, you as a physio, you grab him with the shoulders and you save him not to fall. You understand?
Mhm. Mhm.
Doing that, does that help your patients improving his balance? By all the time when he tends to fall, before there's actually maybe a step reaction, before there is a kind of balance reaction, you say, whop, you play the safety man, right? You help the patient and prevent the patient that he will fall. So that kind of help
Mhm.
is to be a metaphor for going to a patient who is lonely, and we are telling the patient what he should do. So helping by not helping. You understand? In the Eastern philosophy, that's called wu wei, doing by not doing.
Doing, but so like you. But maybe I'm trying to understand it more. Like you grab him and you tell him don't fall, and how do you help him in that way?
Yeah, exactly. So you don't. In my metaphor now, by
Mhm.
doing that, you don't help him to train his step reaction, his balance reactions. You sure you make sure that he doesn't fall,
Mhm.
yeah, but you're kind of hindering him, the patient, to practice his balance reactions.
Uh-huh.
So you do interfere, you do something,
Mhm.
but that hinders his learning. Yeah, he
Yeah,
learns.
but
What he
if
learns.
you if,
Yeah, please go ahead.
because if you stop him from using those step reactions, hip reactions, he's not going to learn to use them.
Exactly.
You're hindering him,
Exactly. Ex-
and that's how you help him. Yeah, by.
So sit on your hands,
Mhm.
yeah, and of course, we need to care that he doesn't really fall. So then we need to be present.
Mhm. Mhm.
Of course, that is a difficult line. How far dare you to go? How far
Mm-hmm.
dare you to challenge him, and how much do you ex- accept that he has the step reaction? Of course, and that's the difficulty in the bio part of the biopsychosocial model. But the same is in the personal part, in the psychological part, right? In the emotional part. Like, do we help a patient who is emotional anxious by trying to completely shift the anxiety, the fear of movement away, instead of wait a minute, let's wait, let's be a bit anxious, because being anxious to move has also positive sides, right? So, it's a kind of a balance. If we would not be anxious, we would just cross the street any time of the day,
Yeah,
right? It's good
we'll be
to,
reckless.
yeah, exactly, exactly. The example of my patient who fell, he would be say, I know, I fell once, who cares? And I go on. So he walks again, and the next time he falls, he might break his leg. Yeah, and yeah, reckless is a nice word.
Really.
So fear has also a positive is also a positive emotion, and if we as physios would immediately, hinder him to learn from the emotion and learn to cope with the fear, then he doesn't learn, then he doesn't improve. And I would say one of our goals as physios is to help our patient to learn to cope better, to learn to, and so forth, in these examples. And
Mm-hmm.
so therefore, back to your example, sit on your hands and help. And in that way, we help our patients.
Brilliant, brilliant.
And that is doing by not doing.
Doing by not doing. Wonderful. I'll definitely reflect on this. And speaking about anxiety and fear of moving and kinesiophobia,
Yeah.
I still remember our classes with the mindfulness and the breathing techniques to
Yes.
really tune into this parasympathetic nervous system and switch off the sympathetic one.
Yes.
All those mind body techniques, do you use them in your practice? And
Absolutely. Absolutely.
yeah,
Yeah, absolutely. So yeah, that's of course a very good question, a very good like say comment on situation. Um, Going back a very long time, we had a French philosopher. The French philosopher is Descartes. He said something like, "Because you think you are right," and we at that time humanity embraced that sentence, meaning kind of a separation of body and mind. So for a very, very long time, the body was something else and the mind was something else. There were two things, kind of, right?
the
Um,
dualism.
the dualism, yeah. Honestly, also in professions, the psychologists were only interested in the brain and the mind, and the neurologists on the nervous system, and we physios maybe only on the body, right? But at the same time, now we see more and more, and evidence and science backs us up to say, whoa, 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 these are kind of, it's one. And of course there are popular sentences like body mind, mindfulness, integration, but actually we cannot see the one out of the other. And as you mentioned, one good example and one good way to understand this is what you mentioned shortly, the parasympathetic nervous system. How intensively one of our cranial nerves, the vagus nerve, how that vagus nerve um, gives feedback to the brain, how the body is, what the situation is of the gut, what the situation is of the heart, specifically heart and stomach and so on. So it is a two-way stream, right? So immediately the brain, the central nervous system, responds on the information that he receives from the vagus nerve, and immediately the information from the brain, the change will be responded by a calming down of the gut, by this cramping of the stomach, by relaxing of the sinus node, by lowering the heart rate, changing blood pressure, and so on. So it's very clear that brain or central nervous system and body are one. Okay, um, and yeah, having that understanding makes us physios almost obliged. It's almost mandatory to start thinking about it, how to interpret now complaints that our patients have, and how we should behave ourselves as well. And so, if we have now the understanding of the biopsychosocial model, and we understand that brain and body is one, or mind and body is one, um, then we cannot deny when a patient comes in, and especially when we talk about, like you said, chronicity, chronic low back pain, chronic neck pain, maybe fibromyalgia, also something which is that you could say, well, it's only in the back. So there we go. That we come in with options how to address specifically this connection. So if you have chronic low back pain, well, shall we dive into it?
Yeah.
Yeah, if we have chronic persistent low back pain, right? For example, kind of all the time your back is nagging you. You're constantly kind of aware of your low back and right. So that of course triggers some kind of emotional state of mind. You get a bit sad, or you get frustrated, you get angry with yourself. So it's kind of an emotional state that puts you in what we call arousal, state of arousal, that pushes you a little bit into a sympathetic drive, and when it continues, you get in a sympathetic overdrive. That means that you're constantly active, constantly trying to be, you're constantly alert, constantly fighting for something that is not there. And that continues doing what? Changing our hormone system, right? Cortisol, most important maybe to mention here today, is a constant presence of cortisol, which has a lot of effects, a lot of reasons, right? Yes, it prepares muscles to be active. Yes, it shuts down a little bit the gut and the stomach for a short period of time. That's good. That's okay. It also shuts down a little bit the melatonin and serotonin production for a short period of time. Because who cares about feeling happy when you need to fight against something, really fighting? Who cares about giving birth to it? You cannot give birth to a child now. You first need to run away. So you need to stay on a high arousal sympathetic state in acute, but chronically, you get worn out. You get worn out. So we cannot stay chronically in that state of high arousal. Yet our patients are doing that. Our patients with chronic low back pain, not aware of this, they remain there. And we as physios, aware of the connection, body mind, aware of this way of being, we have tools, so to say, to say, wait a minute, we can still go into the low back and do exercises for the low back. Yet we also know that low back movements, right, will inform the brain about how it is. And if the brain perceives these incoming messages from the low back as safe or not safe, dangerous or not dangerous, it will respond immediately. And if the brain is still in a state of alarm, a state of hyperarousal, etc., then it will receive this information as unsafe. And with other word, the system has become sensitized, right? And this is what maybe we come in that a little bit to dive into. This would be nociplastic pain. Things have changed over the course of the time, right? But to intervene or to stop this, or this pathway of nociplastic pain, we need to do something to calm down the nervous system. we need to do something to inform the brain about that things that are done are healthy, are safe, are there to recover, right? Because we know only, I would say, only in a parasympathetic state, our body recovers physically and mentally and spiritually, right? So let's not make that mistake to think, okay, we're talking about a low back pain with an injury, with a clear nociceptive trigger. That is already gone, right? There is no nociceptive trigger, but still that ongoing message of danger, as if the brain has something like there is still, but there is not. So now we have, for example, and it has been shown by using heart rate variability measurement, that breathing, meditation, yoga, as examples, yoga, you could say quite physical, uh, mindfulness, relatively, it says it, it's mindful, but mindful movement, mindful positioning. Yoga the same. Yoga has positions like the asanas. Yoga has breathing, and or breathing sec. That all has a wonderful effect on the vagus nerve, and via the vagus nerve to calm down the hyperarousal and set a kind of balance between parasympathetic and sympathetic drive. And when the parasympathetic drive gets a little bit the overhand, healing can start, recovery can start. And again, yes, recovery is also the physical recovery when there's an acute injury, but later one needs maybe to recover from other things. And here, breathing, mindfulness, yoga, Tai Chi, Qigong helps a lot. Yes. And I would say that's also an interesting bridge towards our profession, because Tai Chi and Qigong is movement, plus a little bit more, of course, because it comes from a traditional Chinese vision of life, very of energies and on meridians, but also about balance, yin and yang. Yin and yang is also is you could say is also the balance between sympathetic and parasympathetic. Yang is sympathetic, yin is parasympathetic. There's also these circles, constantly moving circles, balance. So yeah, coming to chronic pain and all that, and yeah. So with mindfulness, with concentration, with meditation, you see that the brain starts to change its pattern. We can nowadays, with functional brain MRIs, really see how doing a 12-week meditation course, how brain patterns starts to change. And that's an important one, because when you have chronic pain, then pain as part of maybe an output from the brain, um, kind of associates itself or wires together with emotions, wires together with core beliefs, wires together with a physical output like hypertone, cramping, low back muscles, right? And in this all is kind of a vicious circle. How to get out of that vicious circle? The patient doesn't know. The patient has beliefs like, oh my God, I have intense low back pain. Let's move less. Let's do less. Um, I am yeah, allowed to panic here because I lose my job, and then I get financial issues. We're back in the biopsychosocial model, as you can hear, right? And the only way out is a surgery. The only way out is medication, is drugs, using strong painkillers, maybe even to morphium, right? And I think we physios, amongst others, but especially we physios, having the knowledge and understanding and the deep insight in this holistic view, in the biopsychosocial context view, we have now the ability to specifically address the parasympathetic nervous system. And how do we know? One more again, we have the ability to measure heart rate variability. And for our listeners, the variability between the beat to beat variability, right? Let's say we have maybe the idea, or I had it at least when I was young, when I had a heartbeat, let's say of 60 beats per minute, I thought every second I would have a beat. nicely,
Hmm.
rhythmically, right? It turns out to
But
be, if that is so, it's not so healthy. It it shows that you are actually that your heart rate, if it's very rigid, well, you could say that's very rigid, right?
hmm, hmm,
Turns out to be that the more you are in a state of being parasympathetic, the
hmm,
more the vagus nerve has a good control. It has a brake. It pushes a brake on that overdrive. The variability gets bigger. So sometimes you have zero point 0.8 seconds between the next beat, and then you have 1.2, and then you have zero point 0.7. The more variability, the healthier it is for your system. The healthier it is for
hmm,
better the condition, your physical mental condition to recover. Um, and measuring this, right? We now know doing yoga, doing mindfulness, doing progressive muscle relaxations, right? Integrating that a lot, breathing in our interventions, it has this effect on the heart rate variability. So patients with with a lot of chronicity, chronic
hmm.
low pain, fibromyalgia, rheumatoid arthritis, you see that they have, in general, a quite rigid heart rate variability. They're constantly in that overdrive, and that's one of the ideas of using breathing, using mindfulness, and so forth in our profession towards our patient. And at the same time, so you cannot you cannot teach or you cannot coach your patient in towards that direction if you yourself come in stressed and say, I have 2 minutes time for you, my next appointment is in 3 minutes. You're breathing heavily, like, okay, I need to rush. So when you are in a sympathetic overdrive, yeah, you can teach your patient breathing yoga whatsoever, it will not work
It reflects. It just reflects.
directly. And there we see that, again, also on a spiritual level, I would say social beings, right? In my way of thinking, now a bit of influence by Buddhism, Zen Buddhism, we are interbeings. We are interviduals. You remember that? We are not. We are and individuals. Yes, I am a person and you're a person, but we are also interviduals. Yes, because as soon as I talk to you, my words come into your ears and your brain makes sense of my words. And at the same moment, I am you. I look at your picture at the moment, and my brain makes of the light coming into my eyes makes a picture of this young, strong, laughing guy with full of energy and interest, and saying and having maybe the energy now. Think, oh my god, my next patient. I need to try on my next patient.
Oh gosh, that's a brilliant point you're making here. Um, makes me think on. I mean, obviously, what you're saying is very important, like addressing the psychological aspects with the breathing techniques and the mindfulness and all of that. But as you can imagine, there are a lot of ethical dilemmas they can arise from focusing only on yoga or focusing only on mindfulness during treatment. That's the thing with physiotherapy. That's what I love about the profession. It's like it's combination of so many things, like the biopsychosocial part. But I want to kind of dive into those ethical dilemmas. Like for a physio, if he focuses only on yoga, only on meditation during treatment, is that really physiotherapy?
Okay,
You
yeah,
know, how,
very good.
how can we not? How can we make it physiotherapy?
Yeah, very good question. Very good question. So you're coming in indeed to the discussion if I would do only this or only that, and indeed you are correct to say, well, we have as in our profession a tendency to be eclectic, and to choose, pick, and that's what we call maybe decision making. And the more we study, the more we know, the more we also are aware of that we know just just a little bit, and there's so much more. Okay, so that's maybe one answer to that. Next would be that I, in an essence, would not say I am now doing yoga with you, or I'm doing Tai Chi with you, or Mindfulness is maybe a little bit different because in the Netherlands, at least, you have really the education to be a mindfulness physiotherapist. So well, that that is not an ethical dilemma in that sense. Um, Yoga could be. So as long as you don't tell or don't believe yourself that you are doing yoga, because honestly, so yoga is more than exercising. Yoga is a lifestyle, right? Yoga is about becoming a vegetarian full time. Yoga is about cleaning all the entrance of your body. So you need to have salt water go into the nose, out of the nose every morning. Uh, Yoga is about meditation. Yes, yoga is about breathing and movement. But yoga is a lifestyle. But we physio say, oh, wait a minute. Uh, Yet yoga as a lifestyle has a certain effect on the human body, has a certain effect on the social environment. And so, hey, and that's typical physiotherapy. We look at it, we read about it. There are studies done about it. So we pick up the scientific literature a little bit, say, hey, that's interesting. It seems to have an effect on the parasympathetic nervous system. Which parts mainly? That's a way of how we perceive it. And then we pick out, like, say, hey, that breathing and positioning, a little bit, let's say, gentle stretching in certain positions, like what yoga maybe for a lot of people is, or awkward positions. But maybe it's, let's say, gentle stretching, which is movement, which is physiotherapy to a certain extent, connecting it to breathing, yeah, slowly breathing, longer exhalations and inhalations, has an effect on the parasympathetic nervous system. So now suddenly, I as a physiotherapy have skills, have tools to address it more clearly, right? Is that so different than, saying, well, let's stretch the hamstrings? That how we did it previously? Not that much, actually, right? We did use breathing. And we said to our patients, if you stretch a hamstring or other muscles, please, patient, keep on breathing. Don't hold your breath. Maybe we did hold relax techniques, right? We said hold the tension, then breathe in for a moment. But when you relax and stretch, breathe out and continue breathing, right? So in essence, we already did it. But now the mindfulness, the attention on, hey, I am now mindful of what I'm doing. I'm mindful of the intention. I stretch my hamstring now, not to lengthen the hamstring. No, with that positioning and that movement and that hold and the breathing, the intention is to lower the sympathetic drive and get the vagus nerve to push the brake. So the shift of intention, and now mindfulness comes in. There is maybe the difference between what we already did and what we're doing now. And at that moment that we explain that to our patients at the start, education, you mentioned it in the start of our talk, as long as you explain, inform the patient about it, and giving the patient a choice, shared decision making. Yeah, we need to explain, right? We need to explain, we need to teach our patient so that they have a real choice. A real choice. Because if you don't have the knowledge, the insight, then the choice is still not clear, still not honest. Then we're still on the part of, but then the patient said, so you decide because you have the knowledge, you know more than I, you are the professional. And maybe you have had such situations already, that the patient says, hey,
Whatever you say.
why ask me? Why ask me? You're the professional. You should know. So tell me what I have to do, right?
Happens to me daily basis, I would say.
So honestly, I explain the intention, the goals to my patients, yet I hesitate / do not tell them this is yoga. But nowadays with the internet, of course, they might come back the next treatment time and say, hey, Rob, I think we did a little bit of yoga, didn't we?
Yeah,
And
but
well, It might be exercises or movement forms, which you also see in yoga. And again, yoga is so much more, right? As is Tai Chi or Qigong, right? I remember that, for example, when we are talking about Parkinson's patients with their balance issues and their difficulties to initiate that movement, starting and stopping, and freezing and all that, that slow and big movements are very helpful for those patients, right? And then diving into the literature, and then let's say the summary of the literature is our guideline, right? The guideline of mindfulness. Suddenly you see a part in the guideline mentioning that one of the optional treatment intervention is Tai Chi Qigong groups. Yeah. So then we say, are you really doing Qigong or Tai Chi? I would say, well, again, that is so much more. It's so much more. Yeah. Because then you need, honestly, having a complete different way of thinking. Yeah? We Westerns, we think, for example, that we are above nature or next to nature. We decide what nature is going to do. And that way of thinking is, if you ask, for example, we have sometimes, you know that, right? Japanese or Chinese, Korean friends, students coming over. And if you talk with them about this conceptual thinking, they look at you, think, well, they don't understand us. What do you mean? Right?
Yeah.
They are part of
They're
nature.
delusional.
They even cannot think like that. So, um, so that's what I mean. If you really say this is what we do, Tai Chi or Qigong, then you need to have another way, another belief system, another thinking system. Yeah. So what are we using? We're using the movements.
Exactly.
We collect those movements, that slow, big movements, right? With walking as well, with a wide stance. Hey, suddenly our Parkinson patients are able to do it, and they also feel by doing that they get a little bit easier in their bradykinesia, in their stiffness, rigidity. So yeah, in that way, an ethical dilemma shifts toward explain what we are doing, educate the patient on the knowledge and give them insight, and allow them to think about it and say, hey, but I really do want something else, and discuss it again. And in that way, maybe the ethical issue is solved or at least discussed. And I think it's very important nowadays that we give our patients. It depends, of course, in the culture, but that in many cultures, and then also maybe in any culture, that we take our patients that seriously, that we at least offer them the opportunity to be decision making together with us. Even though they might then, push the ball back to us, say, no, you're the professional, you tell me what to do, and I do it.
And that's how we become better physios as well, by expanding our knowledge on so many other domains, fields like psychology, like mindfulness, yoga, tai chi, and then like combining all of this into physiotherapy towards helping our patients.
Exactly, right. Yeah.
So big, so big.
Yeah, it's big and it is small at the same time. It is different, and so it's non-dualism. So it is different, and at the same time, it's so small. There are positions in yoga, as an example. There are positions in yoga that are really stretching the iliopsoas quite intensively. Yeah. Now, okay, wait a minute. Now we go back in our profession. Now we have a patient. We have a patient with a hip problem, and we evaluate the patient. One of the work hypotheses we come up with is say, hey, the tightness of the iliopsoas on that left side of the hip really has an important role in his gait pattern and in his difficulties of having a rhythmic gait and maybe even his balance and or pain. So one of the therapeutic goals you might have set for yourself and your patient is improving the muscular mobility of the psoas, iliopsoas. Now you come up with the type of treatment. what kind? Will it be active or passive? Will it be stretching or contracting the muscle, or a combination, hold, relax, and so on and so on, right? So you make a decision. But finally, you come to a decision where you could say, okay, and now how? In what kind of active exercise, home exercise maybe, where we guide a patient towards to, is it maybe optimal for this patient? And you might come into a kind of yoga position then. Say, hey, this is not typically a yoga position. Oh, yeah, questionable, because again, the way we in standing, let's say, stretch the psoas in a standing, and you have that lunge position. Remember doing a lunge position and then pressing your pelvis and your hip forward from the rear leg, and then getting a stretch on the psoas. Now, that is also a position in yoga when you hold it in a position, and then you call it warrior 2 or warrior 1, right? So that's from in the yoga position, popularized with words, it's warrior 1, 2, or 3. So in yoga, you get that position, you stretch the same as in physio, and now you are mindful on where the feeling is, you are mindful on your breathing, as you're really mindful and focused. And again, there comes a little bit that shift. So maybe you would not contract, relax 3 times, breathe in, breathe out, and then done, and go into functional exercising. You would hold it a little bit longer, you would breathe into it, and you would kind of mindfully notice the sense of tension, the sense of stretch, and accept it mindfully, right? Acceptance. Say, okay, this is a feeling of stretch. This is okay. Don't avoid it, but don't distract yourself from that sense. But say, hey, that also is part of life. A stretch on certain issues, and in that way, the patient learns that uncomfortable sensations in moving is part of being a human, right? When you work out, when I work out, we have also moments of uncomfort. We do not
We do.
avoid it. We say, hey, that is part of a regimen, that's part of how it feels to work out. But it's also like part of working as a physio. You work hands-on, and sometimes your thumb muscles and your hands and your fingers, they become a little bit uncomfortable. And you don't run away and start avoiding it and say, hey, that's part of it. You accept it, right? So that's the mindfulness as in our profession, the mindfulness towards the patient, and the combination of is physiotherapy and a certain yoga position really different. It's more similar than different.
Wonderful, wonderful. I see. We're kind of running towards the end of the podcast. If you have time for final question, I want to kind of speculate a little bit about the future of our profession.
Wow.
It's like in the beginning, before we started the recording, you mentioned how the next generation or the next year, the education in the Netherlands for physiotherapy is going to shift a little bit more towards mindfulness, more towards integrating more the biopsychosocial approach into the field. What are your thoughts about it? What exactly is going to change, and what are your thoughts about it?
Okay. You have an hour.
Okay.
No. So the change is a change that has to be made in a certain sense. The change is creating even more patients, humans, that are better in self-managing, that are better in resilience, that are better in coping, and in our a little bit older words, are better in preventing getting illnesses, getting problems, and when they have problems, knowing how to go about. So our profession, our education has chosen to shift more, even more than we were doing, towards trying to prevent. primary, tertiary, secondary, tertiary prevention. And that is also driven a little bit, honestly, still by society. We had it already in the podcast. We're getting older. And by getting older, most of us Westerners are getting sicker, are in need of more and more help of the healthcare system. And our healthcare system is under huge strain. We have not enough qualified healthcare providers to be able to care for all the elderly coming. And that is an issue in a world where we think we want to care for those people who need care. We have created such a society, right? But we also have created a society where care is given by care providers only, and not anymore by communities, by neighbors, by friends. But it is all you. If you have a mental problem nowadays, you don't see your friends, you don't see your family, you talk to the psychiatrist. It's almost kind of an easy goal, where it was maybe 30, 40 years ago. Oh my God, you wouldn't say. With a physical situation, you go to the physio and so forth. You go to your general practitioner. You go to the hospital. So that all in the near future is, in many countries, that's all not possible anymore. So we are kind of trying to look into that glass bowl and see the future and say, okay, the future has to be different organized when it comes to healthcare. Because otherwise, we will have a lot of elderly in need for healthcare, but we cannot provide it. That's one thing. That's one big reason why it is changing. The next thing that why it is changing, because the definition of being healthy is changing. We're coming from a time, and the definition of the World Health Organization is still the same. Like it's something like being healthy is the absence of any form of disease, of complaints, of psychological, mental, physical complaints. And honestly, nobody in his life has situations where he has not an injured shoulder or a headache. But you are still at that moment, you then say, I'm unhealthy. Wait a minute. No. So health is something else nowadays, maybe. So health is more and more the ability to cope with life, with the ups and downs. And when you are down, you have a certain form of resilience and to kind of come back and say, I'm back again, right? Without stressing the healthcare system. And with that, we created a sense of control, a sense of, hey, I have a certain form of control over myself and my environment indirectly, of course. And by looking at it that way, we will have another history taking. Will have another way of talking with our patients. So I'm coming back to, we will have way more a dialogue than an history taking. Why I bombard my patients with questions, first open questions, then closed questions, and then another closed question, right? And to get all the data done, as I have been taught, and I also performed it like that for a long period of time. No, we said, well, wait a minute. It's now way more about the patient who we invite to talk about his life and about how he sees his complaint in the biopsychosocial context and a little bit more, right? And with that, the expectance is, because it's very new, that we create a healthier environment, a healthier healthcare system. And okay, I have to say that ugly word, and therefore less costs. Yeah, it still comes down, of course. I can't deny it. It has also to be manageable by the finances. Who is going to pay for? Of course,
It's important.
yeah. we can still not live on air and love only.
Unfortunately.
Yeah, yeah.
Yeah.
So I fully agree in the importance of yeah, evolving our system. We already are quite good in that sense. So with our biopsychosocial model, we already are really in a good direction as physio. In the physio education and profession, we are using the biopsychosocial model. Yeah, and we are, in a sense, with our decision making and goal setting, we do restrict ourselves on the quality, and we say, well, after 3 or 4 sessions, yeah, we would have reached the goal, and then we say, okay, patient done. Okay, this is what we can do as a physio. Compared to my time, we did without problems 30 treatments on things where you now have 4 treatments, right? And I
Yeah.
don't say the one is better than the other, but if you look at cost restrictions, but also honestly about self-management, and finally everybody, most of us, and not your patient who is lonely, but maybe even a lonely patient, would love to be in control himself about his life, his health, and his sense of belonging and being able to manage itself himself. So we should not be that one that restricts the development of this. And we should maybe encourage it, being the ones who, yeah, who put some extras there so that the patient gets more resilient, more self-empowering. So empowering is a good word. Yeah. So yeah, I see that as part of the future. But that's a way I would also see, and would like to ask you that, because you are young and just started. There is also another tendency in our profession in the Netherlands that young professionals are 5 or 7 years in the profession and then make a switch.
To a different profession.
Yeah, yeah, and that is something where our society of physiotherapists and the educations in the Netherlands are breaking their brains off. Like, how can we? What should we do? What can we do as a society, as an education, yeah, to prevent all the young, energetic visionaries of physios after 5 years saying, you know what, toodle-dogie, bye bye, I'm I'm out here.
Wow. Speaking for myself, it's. I mean, I do love my profession at this moment. I'm still very early in my career. I guess the financial part is a big thing. Like
Yeah,
I'm speaking with another physio here in Bulgaria about it. Like you're comparing yourself to all your friends who are succeeding in their own business fields or whatever, and whereas you're into healthcare, and healthcare is probably not the best thing for being rich, so to say.
yeah,
But after all, like you said, it's very important. We cannot live only on love and uh,
yeah,
happiness.
yeah.
So I guess this is the
Right.
big dilemma here. How can I still do what I love, and how can I, yeah, live a
Yeah,
decent life?
yeah, yeah,
Here for myself, I found the answer that it's a personal responsibility, and whether if the person really has the ambition, has the the I don't know what to say it, but if you want to make money out of what you love, there is a way, I believe, and this way should also be like ethical and moral. So,
absolutely. I love your answer. Yeah, yeah. Okay. Yeah. So thank you, because you made me look into the future. Now I ask you to look also into the future.
thank you for the question. It's thought provoking,
You're welcome.
and thank you for the podcast as well. I think we can close it off here.
Okay. Thank you.
Really, really appreciative of your time, and I believe there was a lot of wisdom dropped here for this 1 hour.
Well, I thank you so much for inviting me, and I was honestly as well super excited for today. I told my colleagues, you know what, tomorrow I told even, you know, how I teach. I told my students, you know what, I have this a colleague now, right? And shortly, and he's already into his podcast and so on. I'm in his podcast.
Wow.
A lot of people very excited about
Yeah.
this. Yeah. So thank you for the invitation, and I hope you
Yeah.
will continue with this podcast and have others interviewed.
Hmm.
Yeah,
I will. I will. Yeah.
and go with your profession, with all your patients, and your personal life.
Thank you so much. I'm really looking forward to the future and what God has stored to me for me.
Okay. Okay.
Inshallah.
Good job.
Thank you once again, and I'll send you the podcast when it's ready, when it's uploaded,
Okay.
so
I'm
you can
very
also share it.
yeah. Keep me updated.
I will. I will. All right.
Bye bye.